is Handsome Nerd ASMR, back with another video. In this video, we're going to be talking about the Streptococcus Pyogenes, which is part of the group A Streptococcus. And the sketchy image shown over here is titled the Pyogenes Bakery. So, we'll go through each part of the image to help remember the important concepts behind the Streptococcus Pyogenes. So in general, the Streptococcus Pyogenes is a gram-positive cocci found in chains. It is catalase negative. It is beta hemolytic. It happens to be encapsulated with hyaluronic acid capsule, and it is bacitracin sensitive. And lastly, it is pyrrolidonyl aroamidase positive, or PYR positive. The way you can remember that it is beta hemolytic is to think about the beta light bulb shown over here that is heating the lamp over the pie. And then for remembering how the bacteria is encapsulated with hyaluronic acid capsule, think about the glass case over the hot apple pie as shown over here. And then the bacitracin sensitive property, you can remember this by thinking about the basset hound that is able to eat the treats as shown over here. And then also don't forget that this bacteria is pyrrolidonyl aroamidase positive. Once again, PYR positive. So for its reservoir, the bacteria can be found in the human throat or the skin. And transmission is through either direct contact route or through the respiratory droplet route. And these transmission forms are important to remember. So remember these two forms of transmission: direct contact and respiratory droplets. Regarding the bacteria's pathogenesis, the hyaluronic acid is non-immunogenic and is going to hydrolyze the ground substances of connective tissues. Afterwards, or in addition, the M protein of the cell wall, carbohydrates, is antiphagocytic. So you can remember this by thinking about the master chef that wears the M hat, as shown over here, who is swatting away the baker that is trying to eat his cupcakes, as shown over here. And as I remember that the M protein is important for antiphagocytic property. Also, streptolysin O is an immunogenic toxin. It is associated with a hemolysin or a cytolysin. And you can remember this by thinking about the O-shaped donuts that are on the counter, leaking as if they are lysed. So you can imagine this as some sort of a strawberry or cherry flavored donut, or any donut with red food coloring that is leaking, and that's when you know that it represents some lysis, probably hemolysis, hence the term hemolysin. On the other hand, streptolysin S is not immunogenic, and it is also associated with hemolysin and cytolysin. By the way, a hemolysin is a specific form of cytolysin, where it is a toxin that breaks down the red blood cells. So, think about O being a toxin that can trigger the immune response, while S is something that prevents, or at least does not trigger, an immune response. Regarding the spreading factors, first we is associated with this bacterium. So first we have the pyoderma or the impetigo, where we have symptoms of pyogenic skin infection with honey-crusted lesions. The key term is honey-crusted lesions and pyogenic skin infection. You can remember these by thinking about the baker who holds the lemon-crusted lemon pie. You can see it's kind of resembling, or at least it reminds you of, some honey-crusted lesion. Probably most important one is the pharyngitis and a strep throat. So, symptoms of abrupt onset of sore throat, fever, malaise, and headache can be induced by this bacterium. And the tonsillar abscesses and tender anterior cervical lymph nodes can also occur. So you can remember this by thinking about the baker wearing the red handkerchiefs around the neck. We also have cellulitis and erysipelas, where this involves the erythema of the skin. So this time think about the baker wearing the big red mittens, as you see over here. We also have scarlet fever, where we have symptoms of pharyngitis, as explained above over here, followed by a blanching sandpaper rash with palms and soles and face that are usually spared. And you can remember this by thinking about the gingerbread man on the counter with red frosting covering most of its body. And it's this gingerbread man here specifically, so you can see that the red frosting, which resembles the sandpaper rash, is covering most of his body, but the palms, the soles, and the face are spared. We also have circummoral pallor and then strawberry tongue, where the strawberry tongue is symbolized by the baker with the tongue out about to lick the strawberry. So think about that. And then we also have nausea and vomiting as some associated symptoms. So that's the main characteristics of a scarlet fever, where we have fever plus sandpaper rash, circummoral pallor, strawberry tongue, and nausea and vomiting. We also have toxic shock-like syndrome and necrotizing fasciitis, where we have a superantigen that invades the fascia under the skin and is going to spread very rapidly. Eventually it becomes a medical emergency and amputations are mostly needed. Think about the baker that wears a super cape with a lightning bolt, with a burned gingerbread man, as shown over here, with the gingerbread man's leg amputated. And you can remember this by thinking about the letter B for the exotoxin and the superantigen causing the disease. Remember that the exotoxin B is responsible for causing necrotizing fasciitis. So that's that. And then we have rheumatic fever. This is another important disease to keep in mind regarding group A Streptococcus. So, a sequelae of pharyngitis, or it represents a sequelae of pharyngitis 2 weeks after the infection, and in a type 2 hypersensitivity reaction. The M protein virulence factor will mimic the myosin structure that happens to be in our heart muscles, and it causes our own antibodies to attack the heart, or it's just any part of the heart, and it just causes our own antibodies to attack the heart, and that specifically may affect the mitral valve. So to remember this, think about the master chef wearing that's what the letter M could stand for. So, and this is really important to remember because it's a dangerous complication of Streptococcus Pyogenes infection. And then other symptoms of rheumatic fever can be characterized by the Jones mnemonic. So, the J for Jones stands for species.